the course structure. Okay, so general anatomy, the course code is MED1023, which just basically means that it is the first, it is during your first year. It's the second course and it carries 3 credit units. That's why the code is like that. So that's how you look at your course code. Okay, so in this briefing, I will just give a bit of introduction to the course, tell you the lectures involved, and tell you a bit about the assessments, how we give the marking and percentages to each assessment, overall learning objective, what you hope to achieve from the course, and references that you may use during the whole course, and how is attendance, and what are our expectations lah. Okay, so just a bit of introduction to the course. Okay, so it's a 4 weeks course. It carries 3 credit units. So 4 weeks would mean about 120 notional hours plus or minus lah. Okay, and I'm the course coordinator. So we had 5 anatomies before, but 2 of them already left to other countries. So we're left with 3. So I'm Dr. Atika, and there's Dr. Rishma and also Dr. Sarah. Okay, modes of teaching learning. Usually we have interactive lectures, we have SCTLs, TBLs, and physical anatomy practicals. But because now it's CMCO, so we had to cancel all the SCTLs and TBLs. Okay, students don't like SCTLs, so I'm sure you're quite glad that we only have ILs. Okay, so next for assessment. So we have the continuous assessment carries 30%, and the final exam carries 70% of the final marks. So for the continuous assessment, 20% will be taken from your mid-course, which is single best questions only. And we will have an online quiz, which is true or false questions. So that will carry 2.5%. And another assessment you will have is the practical assessment. Okay, that will carry 7.5%. You will have, because you will cover all 3 practicals during this assessment lah. Okay, usually for practical assessment, we will give you a picture of the specimen, or in this case, it's histological specimen. So we'll give you a slide, a picture showing a slide, showing something, a structure. And then the answer will be multiple choice. Okay, so as mid-course, quiz and practical assessment will contribute to your continuous assessment, which is 30%. And for final exam, it will be divided into 3 parts. Your SBAQ will carry 35%, your OSPI will carry 10%, and short answer question will carry 25%. Okay, so OSPI is based on your practicals. So usually a specimen, and then we will ask you an open-ended question. So you have to fill in the blank as compared to the practical assessment, which is we give you a specimen, but it is multiple choice. Okay, so in OSPI you have to write your answers lah. Okay, usually it is done in the lab, and then you kind of like rotate. It's like you don't sit at one place. We have the specimens in the lab, and then every 2 minutes, you have 2 minutes to answer one question, and then when the bell rings, you will have to rotate inside the lab to the specimens lah. But I don't know how it's going to be done this time around, because it has to be online. So we will have to see whether the CMCO is lifted or not during the practical, during the 4th week. If it is not, then we might have to come up with other ways to do the OSPI lah. Maybe an online base and just pictures as compared to specimens. We'll talk about that later during the second or third week lah, depending on the CMCO updates. Okay, so overall learning objectives. So basically, this course aims for students to understand the basic concept of the whole body anatomy. Okay, this includes also the structure and function at the gross microscopic level of organization. As I mentioned last Friday, gross anatomy is what you can see with your eyes. So that's your gross anatomy, and microscopic levels, that's your histology. And anatomy also involves embryology, which is the formation of or development of the human body inside the uterus. Okay, so when from zygote to baby or fetus. Okay, so all these three parts of anatomy you learn briefly during general anatomy. And anatomy is important as future doctors, as actually the language of medicine is anatomy. So when you want to inform your colleagues or your superiors regarding a patient, you want to refer a patient to someone, you have to talk about the anatomy of the patient, because that's how you refer to the patient's area involved in the disease. Okay, so anatomy is important later on as well as you become doctors. Okay, so references. I think this what we are using right now, but you can always use other anatomy books as well. There's quite a number of them. Okay. Attendance wise, it's compulsory to attend all timetable slots. And I've created an online form to fill during the slots. Okay, please fill only when the lecturer prompts you. Don't, because the forms are time stamped. So whenever you fill the form, it will come out in our table or in our record what time you filled in the form. So whenever the lecturer will ask you to fill in the form during the lecture, at any point of time during the lecture, they will ask you to fill in the form, and we only accept the forms that are filled during that time. Okay, so if you say then and you suddenly remembered at night that you want to fill in the form, we will know, because it will come out in our record that the time you entered or filled in the form is later than the lecture time lah. Okay, so just keep in mind that we will take attendance at any point of time during the lectures. Okay, so failure to attend, if if the total absenteeism in the course is more than 10% of the slotted time slots, we will give a warning letter. Okay, but failure to attend more than 20%, you cannot sit for your exams and you will have to do the resit exam lah later. Okay, if for example you are not feeling well or you have any other issues, please write a letter to me, or if you are not well, provide an MC lah, and you can WhatsApp or email me your MC or letter. Okay. Anatomy is fun, so enjoy the course. And if you remember, I showed you about the assessments. So if you do your online and practical assessment well, so that can secure you free marks even before the finals. So you will already have about 10% of the marks before the finals, right? So make sure to do them well. Well, basically before we had assignments, but because of the CMCO, we've changed everything to online assessments lah, which are actually quite easy as compared to your exams lah. So don't worry too much. Okay, and try to be punctual, because if not, sometimes in the end or at the early part of the lectures like to give some tips or anything like that. So you might miss on if you come a bit late. And overall, I hope all of you will have a good experience with GA and pass lah with flying colours. Okay, so I'll just show you the timetable briefly. Okay, so this is your first week. We have briefing and intro, which is maybe just half an hour, and then we'll continue with epithelial tissue. Then Dr. Sarah will be giving on connective tissue. And then tomorrow we have intro to osteology and so on. Thursday is a free day for you, so you can have some rest then. Okay, and we should be having practicals next week, Wednesday. But I don't know, I think the CMCO will not be lifted by then. So most likely it will be online. I will update you later on in the week now. Okay, and mid-course and assessment as well. We will discuss and see whether we will be having it online, or we will need to postpone it until after the CMCO. I will update you by Friday lah, if we do, but just prepare lah for the mid-course as well. Okay, and for third week, we're supposed to have 2 more practicals. The quiz and the practical assessment will be on in the third week. Okay, and finally for the fourth week, it's a bit empty, because we give some time for you to prepare for your end of course and OSPE. Okay, so that's about it for briefing and timetable. Okay, continue with intro to human anatomy, or you want a 5-minute break?
Continue, madam.
Continue, then we finish earlier, right? Okay, so for introduction to anatomy. Okay, so just a bit of introduction to what is anatomy, some definitions on the terms and anatomical position, the different planes and sections of the body, and how you describe the terms of comparison and relationships, and also the terms of movements. Okay, so what is anatomy? It's basically the study of the human body. Okay, anatomy came from the word dissect. So previously, during the olden days, to learn anatomy, everyone gathered around a human body, and the professor will kind of cut up the human body and show what are the structures of the human body and so on. That was traditionally how anatomy was taught. Okay, so these are the teaching aids for learning anatomy. Sometimes we have dissection. We had dissection in UOC when it first started, but over the years, it is quite difficult to obtain bodies nowadays, because of the very strict law in Malaysia. So we kind of moved on to prosected materials. Okay, prosected materials are still not human body, but they have been dissected into small parts, and they have been preserved by using some techniques. And so we use prosected materials a lot in our university lah. And we also have some plastic models as well, and digital teaching or learning aids, which is more relevant now in the CMCO era lah. Okay, so branches of anatomy. We have gross anatomy, what you can see with your eyes, microscopic or histological anatomy, developmental, which is embryology. In some places they teach pathological anatomy, and radiographic or radiological anatomy, which is what you see in the X-rays and scans and so on lah. Okay, so what are the approaches in learning anatomy? So for gross anatomy, as I mentioned, we have dissection. Sometimes they teach using regional anatomy or by separating the body into regions. Sometimes, like in UOC, we use systemic anatomy. So after all your basic sciences course, we will have the system-based course. So we will start with like cardiovascular system and all the different systems like respiratory, nervous system, and so on. And you will learn the anatomy using the systems. This is how we do it in UOC lah. Okay, according to the systems. Okay. We also have clinical or applied anatomy, meaning that we relate the normal body anatomy to the diseases lah. Okay, so what happens when the normal body anatomy gets diseases? What are the changes and so on lah. Okay, so microscopic anatomy are for structures smaller than 0.1 millimeter. Oops. Okay, so now we move on to anatomical terminology. Okay, so in anatomy, the terms come from, or in medicine as well, the term are mostly derived from Greek or Latin. Okay, so for example, gaster in Latin is for stomach or belly, so that's why we refer to like any stomach disease or anatomy as gastric. That came from the Latin word gaster. Okay, and for example, delta means triangle in Latin or Greek. So the deltoid muscle is triangular shape, and it is named according to delta lah. Okay, so if you know Greek or Latin, that would be a plus point for you. Okay, so anatomical terms, we have position, planes, comparison and relationship, and also movement. So this is what we call the anatomical position of a human body. Okay, so when we describe the anatomical position, we always refer to this position. Okay, so it is when the head, gaze, and toes directed anteriorly forward. So you can see the head and toes facing forward. The limbs, upper limbs are supinated. Supinated means the palms are facing forward, and the lower limbs are closer together with the feet parallel. So this is the anatomical position. Okay, so from the anatomical position, we can describe the planes of the human body. How, for example, if we do a CT scan, usually we can see the transverse plane of the human body or anatomy. Okay, so if you cut, so there's 4 planes of reference: median, sagittal, frontal, and transverse plane. So if you see, this is how we do a cross section or cut in the human body to view structures from different angles. Okay, so what is a median plane or mid-sagittal plane? It is a cross section, vertical cross section or vertical plane dividing the body into left and right halves. So for example, here you can see, if we do a mid-sagittal section, these are the structures that you can see. Okay, and here as well, in this X-ray of the human skull or human face, you can see this is a cross section of the this is the brain. Okay, and we have the spinal cord here with the vertebra. This is your tongue. This is your nasal cavity. Okay, and your esophagus, pharynx, larynx, and so on here. Okay, so this plane is called the mid-sagittal or median plane, which is right in the center of your of the vertical part of your body. Okay, so how about sagittal planes? Okay, it is parallel to your median plane, but it's not in the middle. So for example, more to the left or more to the right. Okay, a vertical plane anywhere else rather than the center is your sagittal plane. Okay, how about frontal or coronal plane? This again a vertical plane, but it divides the body into front and back. Okay, so for example here, this is a coronal section or coronal cut in the head. Okay, and you can see here this is the brain, right and left part of your brain. This is the cerebellum. Okay, and this is your ventricles. Okay, so just showing you what as compared to this. Okay, so this is the median section or median plane, and this is the coronal plane. Okay, so how about transverse plane? So you do a cut horizontally, or horizontal plane is the transverse plane. Okay, so it shows it cuts the body into upper and lower portions. So this is, for example, this is a horizontal cut through the brain here. Okay, so imagine there's a horizontal cut here, or showing the transverse plane. Okay, this is your eye socket, and this is your nasal cavity from anterior. Can you mute your microphone? Sorry. Thank you. Okay, so this is your anterior part, and this is your posterior part. So you can see from the front here. Okay, this is your eye sockets, this is your nasal cavity, and this is your brain with your brainstem here. Okay, so this is called the transverse plane, where you cut horizontally through the body. Okay, so we've done planes. Now we will look at the terms for comparison and relationship. So again, this is your anatomical position. So all the terms in anatomy we use as with reference to the anatomical position. Okay, so for example, superior or cranial is any structures closer to the head. Okay, and caudal or inferior is structures closer to the body. So for example, if you have a lesion here, and then how do you describe? Say for example, this man has a cut inferior to the knee. So you say inferior because it's closer to the foot. Or if you say the patient has injury here, so you say you can refer to it as more superior. So for example, the patient had a fracture superior to the shoulder, for example. Okay, so terms of reference, how to compare structures and so on, you use superior or cranial, and caudal if it's towards the feet. Okay, how about anterior? So anterior is something to the front, and posterior or dorsal is something to the back. Okay, then we have medial and lateral. So anything closer to the median plane or the midline of your body, that would be more medial. Lateral would be more being further away from the midline. So for example, you want to describe a lesion here, for example. So or maybe here lah, easier. Okay, so you want to say there's a lesion lateral to the forearm, for example. This is a forearm. So lateral would be your moving further away from the body. If it's median, it would be moving towards the midline of the body, or a structure closer to the midline would be more medial. A structure further away would be more lateral. Usually, for example, if we have three structures, say your vein, artery, and nerve, say they're next to each other. So the structure that is more further away from the midline, so you will say that is the lateral part. Moving which structure is closer to the midline, you will say the medial part. Okay, so in terms of comparison and relationship, we also have distal and proximal. So any structures that are distal is structure being most further away from the root of the limb. Usually we use it for upper and lower limbs, for distal and proximal. So distal, this is the root of the upper limb is your shoulder joint, and the root of your lower limb would be your hip joint. Okay, so anything closer to your root, which is your shoulder or your hip joint, that will be proximal. Something distal would be moving away from the root. So for example, if you have two injuries, one here and one here, so you would refer to injury number 2 as being more distal to injury number 3 because it is more further away from the injury here, for example. Or you want to say fracture is here and the wound is here, so you would say the wound is more proximal compared to the fracture here. Okay, so it's just terms of reference how you compare relationship or of two structures at the limbs. Okay, so here it's just showing you the root for the lower limb lah. Okay, how to understand, and this is the root of the upper limb. Okay, so for example here you have your radius and ulna, okay, and this is your humerus. So you can describe the radius and ulna is more distal to the humerus, for example, because it is moving further away from the humerus, and the humerus is more proximal to the radius and ulna because it is closer to the root. Okay, and here as well, this is the root, which is the hip joint. So you can say the femur is more proximal as compared to the tibia and fibula. Okay, because it is more closer to the root. Or you can describe the tibia and fibula as being more distal to the femur. Okay, because this is more moving further away from the root as compared to the humerus. Okay. So in terms of comparison and relationship, next will be superficial and deep. So as the name suggests, if it's closer to the skin, it's superficial. If it's deeper, then it's deep lah. Okay, so for example, any lesion here as compared to inside the abdomen, that would be superficial and deep. Okay, palmar would be at the on the palm of your hand. So if the lesion is on the palm, you will say it's palmar is a palmar lesion. Plantar would be at the bottom of the foot or sole of the foot lah. Okay, and if it's internal, external, as the name suggests, being inside and outside of a cavity. So here, for example, near your ribs, you have your internal and external intercostal muscles. So from the outside, you have your external, and inside the cavity, you have your internal intercostal muscles. So other terms for laterality, for example, usually say for example the patient has stroke. Okay, so you can use these terms of laterality to describe which parts of the body is involved or has the weakness. So for example, if the weakness is only on one side, so you say there's unilateral weakness. If both sides are involved, it's bilateral weakness of both limbs lah. Okay, and if the lesion is, so for example in in stroke, the lesion is in the brain. Okay, that causes the symptoms or weakness in the limbs. So if it is in the same side of the body, usually cerebellum. So if there is a stroke in the cerebellum, you have ipsilateral weakness, meaning the stroke happens in the right side of the brain. The weakness is also in the same side, which is the right side, then you call it ipsilateral. If it's in the opposite side, so for example, if the stroke is on the right side of the brain, but the weakness is on the opposite side, then you call it contralateral weakness. Okay, so usually we use in the most common use is in stroke or brain disease lah. Okay, and then for prone is where you lie facing down. Okay, and supine position is facing up. Okay, so for in terms of movement, flexion will be bending, or you decrease the angle between the body parts. Okay, and extension is the opposite, where you increase the angle between the body parts. Okay, hyperextension is extension but further, meaning, for example, here, if this is your neck, okay, flexion would mean you bend it forward. Okay, so the angle is smaller. Extension will mean when your head is face up. Okay, hyperextension will mean when you have the angle is greater than extension. Okay, or beyond the anatomical position. Okay, so this is again an example of wrist. Okay, so flexion will mean reducing the angle from anatomical from the wrist extension would be at the anatomical position. More than the anatomical position, that would be your hyperextension lah. Okay, these are just examples of flexion, extension, and hyperextension. Okay, adduction is movement towards the midline. Abduction is moving away from the midline. Pronation is rotation movement of the palm facing down. So this is pronation. Supination is movement or lateral rotation of the forearm where the palm is facing upwards. Okay, usually for physical lectures, I get someone to do the movements, but unfortunately in online we cannot. Okay, so rotation is moving the body parts around the long axis. This is the long axis, so moving along it will be your rotation. External rotation and internal rotation, and circumduction is the small circular movements here. Okay. Lateral flexion, moving laterally, remember, lateral and medial. Movements of the foot, we have inversion, eversion towards outside or laterally, dorsiflexion and plantar flexion. Movements of the wrist and thumb, so we have radial deviation, this is your radius and this is your ulna, so movement towards the radial side will cause radial deviation. Ulnar deviation is movement towards the ulnar part of your hand. Okay, opposition, when your thumbs are together with your pointing finger, and reposition is back to the anatomical position, or the opposite of opposition. Okay, protrusion, moving a part forward. Retrusion is moving it backwards. Okay, this is at the jaw. Elevation, again, of the mandible or jaw. Elevation is when you close your mouth. Depression of the mandible is when you open it, or in the case of a shoulder, elevation and depression, moving down. Okay, protraction, moving it forwards. Retraction, moving backwards. This is actually protraction and retraction of the scapula against your thoracic wall. Okay, so that's all for terms in anatomy, for gross anatomy or description of what we can see from the eyes. Okay, for microscopic anatomy or histology, there's two types. We have the light microscope and electron microscope, but in our university we only have the light microscopes, so we can see images of section tissues, but in low resolution only. We cannot see like this finer and smaller particles lah. Okay, so this is for example, in a light microscope, this is the ciliated epithelium. You can see cilia, and this is the epithelium lah. Okay, but if you use an electron micrograph, this is what you can see. So for for the cilia, which is this big, it becomes more enhanced or more clear if you look in the electron micrograph or electron microscope. And even with technology nowadays, if you have scanning electron micrograph, you can actually see the 3D version of the cilia. This is the same structure here, showing the cilia, but in different types of microscope. So in our university, this is the best you can see lah for now. Okay. So this is if in the study of anatomy. So whatever you can see with the human eye is your gross anatomy here. Okay, and this would be your histology or microscopic anatomy. Okay, just to show you, with what we have in the lab, the compound light microscope, we can only see structures up to this big, 1 micrometer. But if we have the electron microscope, we can see up to 1 nanometer, very, very small particles. Okay, that's it for introduction to human anatomy. You want to continue or you want 5 or 10 minutes? Sure.
5 minutes.
Okay. Can you all fill in the form for attendance for the first lecture?
Okay,
First and second. So I'll give you 10 minutes to fill in the form for attendance for the first and second lecture, and I'll come back at around 8:55 maybe. Okay, for the epithelial lecture.
Doctor,
Yes.
where's the form?
I post in the Teams group, right?